So,
Hmm.
today I will be presenting my seminar on the topic cardiac biomarkers. So, what are cardiac biomarkers? They are measurable indicators of biological processes or diseases. They are specifically used to diagnose and monitor cardiac diseases such as myocardial infarction. What is myocardial infarction? It is described as decreased blood supply to heart due to coronary vasospasm and atherosclerosis. Coronary vasospasm is sudden constriction of arteries due to some issue, and atherosclerosis is deposition of fat and cholesterol in the blood vessels. And this leads to necrosis, ischemia of heart muscles. It results in chest pain and ECG changes. What is congestive cardiac failure? It is the inability of heart to pump blood effectively needed by the body. Characteristic features of ideal biomarkers. They should be able to detect the disease easily. They should be specific and sensitive. They should tell us about prognosis and help in monitoring. Some important biomarkers are creatine kinase, cardiac troponin, myoglobin, brain natriuretic peptide. Other enzymatic markers are LDH and SGOT. Creatine kinase. Its levels are elevated in case of myocardial infarction and muscular dystrophy. It has three isoenzymes, each having two dimers: CPK1, CPK2, and CPK3. It helps in interconversion of phosphocreatine to creatine and vice versa. Uh, we will see about CKMB. It it is released within 6 to 18 hours of the disease and attains its peak level within 24 to 30 hours and returns to normal state in 2 to 3 days. Cardiac troponin, they are specific markers for myocardial infarction. They are non-enzymatic biomarkers. They are of two types, troponin I and T. Troponin I is released within 4 hours of disease and attains its peak level within 12 to 24 hours and returns to normal within 3 to 5 days. And troponin T is released within 6 hours, attains its peak within 72 hours and returns in 10 to 14 days. Now, myoglobin, it is released in 2 hours and reaches at its maximum within 4 to 6 hours and returns to normal within 3 to 5 days. And this is the graphical representation of concentration of different biomarkers at different times after the disease has taken place. Now we come to lactate dehydrogenase. It helps in diagnosis of myocardial infarction, infective hepatitis, leukemia, and muscular dystrophy. LDH is predominantly found in heart muscles, and in case of myocardial infection, the LDH1 levels are much more than LDH2 levels. It is released within 2 days, attains its peak within 3 to 4 days, and returns to normal within 10 to 15 days. SGOT, serum glutamate oxaloacetate transaminase. It is also known as AST, aspartate transaminase. Its levels are elevated in case of myocardial infection. It attains its peak within 30 to 48 hours and returns to normal within 4 to 6 days. And this is the result of electrophoresis. We can see the different levels of isoenzymes of LDH. In case A, this is the result of normal serum where the levels of isoenzymes of LDH are normal. In case B, it is a case of serum from a patient of myocardial infarction. Here, the levels of LDH1 and LDH2 are slightly elevated, and the rest are normal. In case C, it is a serum from patient of liver disease. Here, the levels of LDH5 are increased. Thank you, ma'am.
Lecture. Tell me, out of so many enzymes and non-enzymes as markers, myoglobin and TROP-T, you showed me that they are the earliest marker to raise in the blood. So out of these, like myoglobin and TROP-I, which one is more good and more ideal?
Troponin, troponin is more ideal.
Why so? Why not myoglobin while it is raised within 2 hours after the attack? You are right. You are absolutely right. But you should have logic behind this. Okay? Myoglobin is non-specific. Other than cardiac injuries, it has been found to be raised in other diseases as well, right? But ROBT
Yes.
is very specific to heart injury, cardiac injury, right? Okay,
Yes.
thank you so much, everyone, for
Thank you.
contributing your time. It has been indeed very interesting lecture. So after now, rest of the seminars we will take up after the examinations. So have best studies, keep continue your studies. Any difficulties, problem, you can connect me online or offline anytime. Your college is open, we are there. All the best.